Let me start off with this. The big debate again over face shields. I'm sure you've heard the back and forth, and we've been hitting it for a year, but now it's back again with a vengeance. Manila is declaring that it is not requiring face shields anymore. The MMC, the council, is recommending that it not be imposed. You have Davao, Iloilo, and Cebu also saying the same thing, and yet we're still waiting for IATF. What should we believe?
Akala ko we were going to talk about the Pediavax first.
Well,
Yung mahirap pa yung pinag-usapan natin kaagad.
We'll also get there.
Well, ganito. I understand kasi that there are certain guidelines or rules that IATF has the prerogative to impose. And I think these restrictions on PPE is the prerogative of IATF. So I think that's where they're coming from. I don't think it's a question about whether the face shield should or should not be allowed. It's just a decision-making process that they're objecting to, or that there's an issue about.
Yes, Doc. But we were wondering about your medical expertise. Yes, sir. Yes, ma'am. Your medical expertise.
Well, ever since naman kasi, the view about the face shields is that it provides an additional layer of protection, particularly to prevent entry of droplets into the eyes. Kasi it's a portal of entry talaga. Now, syempre, when we talk about using PPEs, you balance the risk of transmission, where it enters, and the rate of transmission. And one of the things that has really changed in the past few weeks is the fact that we are on the downturn in terms of our cases. We have decreased our alert levels, and so it becomes appropriate again to re-examine whether all of the PPEs need to be in place, some of the PPEs need to be in place, or we can modify.
The infinite scenarios that you can imagine kids getting into. Kasi ang dami, di ba? Parang public transport, malls, restaurants, indoor dining, al fresco, now even gaming, going back to computer gaming centers. Which will give you more the most fits?
Siguro kung I think many of us naman have imbibed the habit already of using our PPEs properly. Medyo nag-hesitate ako doon kasi marami pa rin ako nakikitang hindi tama ang suot. Pero granted na lang.
Actually, marami pa rin talaga. Yung nakababa yung face mask.
Pero I think wala naman yatang nangangahas ngayon na lumabas na wala man lang face mask. Kahit na medyo alanganin yung suot, kahit papano, I don't think we're used to leaving our homes now without face mask. So kahit papano, we can do that. I think the only other thing that would I would remind kids about and their families is be conscious about air quality kasi hindi siya top of mind sa atin eh.
Yeah. And what about yun na nga, yung face shield. I mean, pati ba yung mga bata pag face shield? Assuming na i-insist pa rin ng IATF na kailangan pa rin ng face shield. I'm just trying to find some logic in this protocol, no? Because there's so much debate over whether face shields work or not, and yet, now we're allowing the kids to go to crowded places. So parang feeling ko, halimbawa yun, parang aren't we rendering them, going by the logic, more vulnerable now? I mean, they're unvaccinated. I don't think that there are face shields tailored for kids, especially 2-year-olds or 3, whatever. No, aren't we subjecting them to, the dangers of this virus if we go along with the IATF warnings on the virus being still out there? Parang hindi ko makita kasi yung consistency sa decisions on the protocols. So, yeah.
Well, siguro the decision making is not. It takes into consideration a lot of other factors. But siguro if we were just to talk about the science, diba? Siguro the easiest way to understand this is in the healthcare setting. Even before COVID came along, eye protection was necessary for certain procedures because we knew that you could get virus or bacteria and infect yourself as a healthcare worker if you didn't have the proper eye protection. So,
Yes.
etong COVID actually just adapted those processes. And so, whatever IATF decides for the general public, the science will still support the fact that if you have this additional layer of protection, it's going to help you with avoiding infection. Hindi
So will
magbabago
we
yung
let
ano na
the
yun. Hindi
kids,
magbabago yung reality
Yeah.
na yun, di ba?
yeah, kaya nga, so will we let the kids wear face shields? Would that be an
Pinapayagan
added
naman
protection
sila.
for them?
Pinapayagan naman sila.
Hindi sa pinapayagan eh. Kunyari, you make them play in the arcades, but they have to wear their face shields and that's supposed to be additional protection for them. I mean, is that practical that we even allow them into the gaming arcades, and yet we recommend to wear your face shield?
Yeah,
so that
I can get where you're coming
protected
from.
them.
Parang if it's safe enough for you to be there, why are you still
Yes.
being... Yes,
Exactly.
Tama naman yun. Tama naman yun.
And then
And that's
require
why...
them to wear a face shield. That's
Correct.
so weird, isn't it?
Correct. That's why it's being discussed, di ba? Parang to make it consistent. Kung sinasabi natin na safe enough na magtago ka dyan sa kulub na lugar, di dapat pwede ka nang walang face shield. At lalo, baka pwedeng wala ka na ring mask.
Yeah.
So dapat ganun nga.
Not only that, I
That's
mean,
what
this
being
doesn't
discussed.
add anything except just another example. But I remember early on in the discussions, hindi pa rin natin pinapayagan magpunta sa eskwelahan, pero hinahayaan natin magpunta sa mga mall.
Exactly.
Yeah.
Exactly. So all of that is, maybe I would say it's being aligned. Kasi nga syempre, di ba, lahat naman tayo naintindihan natin to, lalo na yung konsepto na why would you allow kids to engage in leisure activities and restrict them from going to class? So dapat to make it consistent, dapat as you allow or as you say that there's less transmission, therefore you're allowed to engage in leisure, di dapat mas lalong pumapasok ka sa eskwelahan.